There are going to be 9 muscles that are crossing the shoulder joint to the glenohumeral joint, and that will insert on the humerus and therefore move it. Some of these guys are going to originate on the scapula, others are going to originate on the axial skeleton. And their actions will include flexion, extension, and adduction. The 3 prime movers of the upper extremity include the following 3 muscles. Pectoralis major. Its main actions include adduction, as well as medial or internal rotation of the humerus. In addition, it can help with forward flexion of the arm. On the other hand, pec minor, which isn't on the list, by the way, but you do need to know its actions, will mainly be a stabilizer of the scapula. It will also help depress, abduct, and internally rotate or medially rotate the scapula. Latissimus dorsi is that very big muscle which we saw at the end of the last section, and we'll see again in a second or two, is going to have a couple of actions or several actions which will include adduction and internal rotation of the glenohumeral joint. Those are the ones I want you to know. It will also allow for trunk rotation. The deltoid, we know, is the major abductor of the upper extremity. The deltoid can also engage in forward flexion as well as extension of the upper extremity, depending on if you contract the anterior fibers for flexion or the posterior fibers for extension. I put red arrows on the muscles that you absolutely positively need to know. So deltoid, pec major, and latissimus dorsi are all marked. Rotator cuff muscles are a very important group, and you need to know these not just for this class, but forever. They will act as synergists and fixators. They're all going to originate on the scapula. They reinforce the shoulder capsule, that joint capsule around the glenohumeral joint, and they help prevent dislocation. They are the so-called sits muscle, supraspinatus, infraspinatus, teres minor, note teres minor, not teres major, and subscapularis. So let's take a look-see. Supraspinatus will sit superior to the spine of the scapula, hence the name. Infraspinatus is going to sit inferior to the spine of the scapula, hence the name. Teres minor is also part of the rotator cuff group, and subscapularis will sit in the fossa on the deepest part of the scapula, the part that is actually going to lie up against the rib cage. So you can see their various actions. Supraspinatus is going to help elevate the shoulder joint out to the side. That's layperson's terms. Infraspinatus will externally rotate the glenohumeral joint, as will teres minor. Subscapularis is going to allow the humerus to have a pretty great range of motion during elevation of the arm. Once again, you can see supraspinatus, you can see infraspinatus, teres minor, can't see subscapularis, but the ones with stars, the 3 muscles with stars, are part of the rotator cuff group. On this image, you can also see triceps brachii. That is going to be the major extensor of the elbow. Anconius, which is listed at the very bottom, is a weak synergist to triceps brachii. And we talked about latissimus dorsi, which will actually insert upon the humerus.